Hey Adapters, I'm Doug Parsons. I'm a partner at Simpatico Studios, where we live stream conversations about complex business and social challenges with professionals like yourself who are working on the same issues. Our shows are live streamed in front of a global audience of your professional peers on simpatico.tv. I'm building a new type of online community for professionals like yourself on the Climate Adaptation channel. If you're a regular listener of my America Adapts podcast, I think you'll find that we're taking our conversations about important problems, policies, and solutions to the next level here. And if you're interested in being a guest, we'd love to hear from you. And now join us for this latest episode. Hey Adapters, welcome back. Today our guest is Dr. Carlee Purdum. Carlee is a social scientist and research assistant professor within the Hazard Reduction and Recovery Center at Texas A&M University. Her research and work centers on the relationship between criminal justice policy and hazards and disasters, and more specifically, the social vulnerability of incarcerated persons. Carlee will explain how incarcerated populations are highly vulnerable in terms of being disproportionately impacted by disasters and hazards. Talks about how COVID-19 has complicated the hazards and how climate change can add to the woes of the incarcerated community. She explores what steps can be taken to mitigate their suffering. Hey, Carlee, welcome to the show.
Hi, thanks for having me.
All right, well, you're at Texas A&M, and I guess just first off, this is a really interesting subject. I'm looking forward to this conversation, but it occurred to me, how did you get started on this subject? How did you get wrapped in focusing on the prison populations and such?
Sure. So I was actually working in grad school on a project looking at long-term disaster recovery here at the Hazard Reduction Recovery Center. We were looking at long-term recovery in different disasters across Texas. And I was doing an interview with a local government official talking about, the importance of relationships in disaster recovery. And we somehow got on the subject as to what relationships are very important, and this local official whose community had been devastated by the wildfires back in 2011 started talking to me about the role of the Texas Department of Criminal Justice in their disaster response and recovery efforts. And he talked to me about how incarcerated firefighters in Texas actually were kind of pitched to them as an idea to how to respond to the next big wildfire in their community. So when I heard that, I had heard of incarcerated firefighters in states like California, but I didn't realize kind of how widespread the practice was. So started digging into different state policies and emergency plans, and found that the majority of states in the US rely on incarcerated persons to do a wide range of disaster labor. And on the other hand, seeing that those same plans that are also include actions on how to protect incarcerated populations in disaster, there was really not a lot of consistency, or there was some states would refer to them as a vulnerable population. Some states would talk about the need to evacuate in terms of a disaster. But overall, there was really a lack of how to protect incarcerated persons, but there was definitely a strong pattern and consistent pattern of using incarcerated persons to respond to the state's needs and needs at the local level.
Okay, can you give us examples of how prisoners are vulnerable to these different disasters? I mean, just it might seem obvious, but could you give some examples?
Sure. So the most common kind of easiest way to understand the vulnerability of incarcerated persons is they don't have agency in taking protective actions or protective measures in the same way that non-incarcerated persons do. If there was an evacuation order in your community, you would, be able, if you had the resources, you would be able to evacuate or go to a local shelter. And incarcerated persons have to fully depend upon the prison staff or the decisions made at the state agency level as to whether or not an institution is going to be evacuated or not. So it really depends on what happens to them. They have very little to no control over. So they have to depend on others to make those decisions and make that happen for them. And often those decisions are, to not take those protective actions for incarcerated persons because it's very expensive. It's very challenging to, plan or address the needs of an institution that holds hundreds and sometimes thousands of persons. So at the very least, their understanding is that they don't have that agency that you and I have to protect themselves. They also don't have the ability to get medical care or food or those kind of necessary resources on their own. They again have to depend on prison staff. They're also socially and geographically isolated. So prisons and large correctional institutions are often located in more rural areas. And that came from a need to find cheap tracts of land for the government to build these institutions on. But that often means that they don't have the same access to emergency resources that we do. And then the social isolation is that incarcerated persons aren't really able to communicate with the outside world with the ease that non-incarcerated people have. So especially in a disaster or in some kind of an emergency, they're not able to communicate with the outside world to say, this is what's happening, this is what's going on. So they're really restricted socially and out of the public eye. So often those kind of impacts go either unreported or unseen. And then they're also a stigmatized population. So that often translates into a low priority for resources. And talking about their social isolation, even when incarcerated persons are able to communicate about what's happening to them, because they're a stigmatized population, their accounts are maybe not believed or are doubted to a larger extent than a non-incarcerated person's would be. So there's always a doubt as to what account are we supposed to believe, the official account coming out of the institution, or are we supposed to believe the account of this convicted person, per person convicted of a crime. So those are some of the kind of basic understandings of why incarcerated persons are disproportionately vulnerable to the impacts of a hazard or a disaster.
All right, so the notion that they're not getting the advocacy that they need, but I'm wondering, like, let's say a prison's in the way of a hurricane that's coming. Are there literal, like, legal triggers that require them to evacuate a prison, or is it still someone's subjective call on the matter?
It's definitely a subjective call. The most powerful and tragic example is the Orleans Parish Prison in Hurricane Katrina. So the OPP was in a mandatory evacuation zone, and the rest of the community was told to evacuate, but the officials, the sheriff responded that we're not going to evacuate the prison. The incarcerated persons are exactly where they belong, and we're going to keep them where they belong in the prison. And so the impact of what happened was Hurricane Katrina hit. The impacts were devastating. Many of the prison staff left. They evacuated with their families. They walked away from the environment, and instead of allowing for the incarcerated persons to be released, they were left in the prison with contaminated waters up to chest high, no access to medical resources or water or
Wow.
food. And when many incarcerated persons did try to escape, they were met with a violent response. So when an incarcerated person is in a prison and a disaster happens and the situation becomes very dangerous and they try to get away from those impacts, they're seen as escaping from the state. So they're met with a violent response. And we saw that happen with Hurricane Katrina. So that was one of the most kind of visible impacts to any prison from a major disaster in the U.S. And it led to, a uptick in emergency planning for prisons. The understanding, there were conflicting reports as to whether or not the prison had an emergency plan as to what would happen if there were a hurricane like Hurricane Katrina to hit. What would under what context would they evacuate that prison? But those conditions are definitely, or those decisions are up to the leadership, and depends on, what they decide and what resources they believe they have. And those decisions really have to be made ahead of time, because again, because you have the way we incarcerate people creates their vulnerability. Where you have a prison that has hundreds to thousands of people in them, imagine how long it would take to evacuate that institution, and what kind of, they have to go somewhere. So there has to be agreements ahead of time with who's going to take them. And so that was definitely one of those major incidents that led to a lot of attention, but it's definitely still a leadership decision as to whether or not those institutions will evacuate.
Well, I think over the last 20, 30 years, we've privatized a lot of prisons. Are you able to look at saying, all right, private prisons versus public sector prisons, they do it differently, they do it better? Have you been able to look into that?
Private prisons are more challenging to study in this area because their materials are not as public as, say, state institutions are. So I don't know. But I would say that there is a wide range of states and how they plan, and what they mean to do. We definitely see an increase of evacuating facilities in the last, I'd say the last 5 or 6 years. You have institutions in, say, the state of Georgia that have really only been evacuated a handful of times in their entire history, but that's happened with these major hurricanes in the last couple of years. So there's definitely an increase of institutions that are being evacuated, but that's also because there's an increasing impact of many of these, major events, to where the institutions become, unlivable for incarcerated folks or for the staff that work there. So a lot of these states are seeing their hand forced because of the bad publicity that comes from the mishandling of a crisis like that. But also just the conditions that come from exposure to a major disaster.
All right, so we're talking hurricanes and such, but what about climate change? How do you sort of talk about climate change in the context of prisons? What are the impacts? Is it just storms are getting more fierce? How are you looking at it?
Well, we see that prisons are, and prison administrations are very concerned about the impacts of climate change. There's a lot of impact, say, day to day, that with many prisons across the U.S. and prison systems that are struggling to keep staff numbers up, to keep the day-to-day functions of their prison system going. But they are concerned about what does the future look like. Probably the most significant example of this is the 2014 report from the National Institute of Corrections, which is talks about the impact of climate change in prisons. I believe it's titled something like Resilience in Corrections. And in that report, they talk about all of the different issues that they see climate change and impacting prison systems, from increasing extreme weather events, leading to an increasing number of lawsuits as the conditions in prisons deteriorate. They see higher costs to operate and keep their institutions running. Infrastructure failure, looking at roads, at the actual physical infrastructure of the prisons as crumbling, as these more extreme weather events and extreme temperatures kind of become more impactful. They see resource strain on the ability to access food, to access water. They're concerned about failing infrastructure to, power infrastructure, which keeps prison institutions running. And they're concerned about new and extended health impacts because of those hazards, from talking about extreme weather events, but also new diseases and the spread of infectious disease. I know we're going to talk about COVID-19, but we also saw this happen with Zika. There was an enormous concern in many states about the impact of the Zika virus on incarcerated populations. And then also just kind of increasing violence within the institutions due to just deteriorating conditions. So we see this in prisons here in Texas, where many of our institutions don't have air conditioning. And so what that means is the conditions within the institutions are miserable, not just for incarcerated persons, but for staff. And institutions have seen that led to more friction, more tension, more violence within institutions when the conditions are really deteriorating to the point that they have already, and to the point that they see those conditions deteriorating in the future.
All right, so just a couple comments here in the community room. We could go back to some other questions, but Zach says, I love when my fellow Aggies are on the show. So just a little plug for you guys. And then Sarah asked, and this is related, I think, to what I said earlier, do you know of any states that do have triggers set for evacuation of incarcerated prisoners?
I don't know of any states that have inset written triggers, but I can tell you those conversations happen at the state level, and they are happening. And you do have states that they have emergency operations persons on their staff, especially with the professionalization of emergency management. You do have staff positions in these state agencies that are watching the conditions and are concerned. And I think you would see a lot more evacuations or different protective actions happening if it wasn't so costly, and if it wasn't so challenging to get the resources in place. So when you think about in terms of evacuation, you're looking at an enormous amount of overtime to pay for staff, to secure the resources to move incarcerated persons. And when you see struggles for funding in terms of prison systems, our prison systems are extremely expensive, but it would take an enormous amount of financial resources to actually protect incarcerated persons from hazards and the impact from disasters. And so really what we see is the most cost-effective and the most cost-effective decision that could be made would be to decrease the incarcerated population, to decarcerate. And that would mean taking people out of the prison system that really shouldn't be there, or that we can look at responding to crime in the long term in a different way. Because the way that we respond with incarceration creates a lot of danger, creates a lot of harm for incarcerated persons, for staff, and for those communities, because that harm tends to spill out onto local communities. So I would say, that's definitely a discussion that needs to continue and grow.
All right. So if I understand that right, prison reform is in itself an adaptation action, because if you're getting more people out of the system and all that, it's interesting. It's just, I think that's what you were saying.
Right. Yes. I mean, the strongest call right now, especially in the context of COVID-19, is to decarcerate. The prisons are so full. They're not. We don't have the resources to make them safe for anyone. But also there needs to be conversations about reimagining how we respond to crime, and the way that we incarcerate people in and of itself creates a lot of hazards. And we see that in the institutions themselves, and that they are, vulnerable infrastructure, but they're not given the resources to maintain that infrastructure, and they're full beyond capacity. We have so many people in these institutions that were never designed to, incarcerate that many people. And even when, the United States kind of embarked on this experiment with incarceration, it's called, because we are the world's leaders in incarceration. And when we looked for these, cheap tracts of land to build these institutions on, there was really no concern about what the hazards are in those areas. And so now you have, over the last several decades, you've had enormous issues with hazards exposure and increasing hazards exposure, flooding, wildfires, hurricanes, any type of hazard that could impact any kind of institution. We see that those were not considered when we bought this land or built these institutions. And so those decisions, now we're seeing the impact and the kind of devastation that the lack of that planning, the lack of that consideration has on these institutions and their communities.
All right, well, we're getting toward the end of the episode, and I want to make sure we have a little bit of time. And you've touched upon a little bit, but COVID, obviously, just a big bomb going off in prisons right now. And would that even? How would you even list that in like your shop? Is that like a hazard? I mean, How do you even describing COVID, the disease there?
So, COVID is definitely what I would describe, a public health hazard. But from what I've seen, it's the same conditions that and make incarcerated persons vulnerable to hazards that have made them disproportionately vulnerable to COVID-19, where the way that we incarcerate people, who we incarcerate, has led to these, devastating impacts. So looking at being socially and geographically isolated, they're away from resources that would be, needed to combat, like public health resources or local health infrastructure. And, they can't take these protective actions on their own. So when states states are very comfortable, I've written about this before, in using incarcerated workers to produce resources for everyone else, for the state, for local communities, looking at PPE, getting out materials for other people to protect, but they don't give that same kind of, we don't see this universal attention given to incarcerated populations to make sure that they're able to social distance, to access PPE, to have, those resources to protect themselves. And then even the conditions under which they're working in these factory settings where they're producing, personal protective equipment for other people, they're in these factory settings that expose them to COVID-19, the conditions that don't allow them to social distance. And the lack of personal protective equipment has led to a lot of concerns about using incarcerated workers to respond to this crisis. So it's many of those conditions that I see as applying to any other hazard and disaster that have to be addressed in terms of the conditions that make incarcerated persons vulnerable.
Okay, before we wrap this up, what are some things that you're working on? I guess recommendations how prisons can adapt to climate change. You had mentioned a report that an association wrote, but is that something that's out there that's coming?
I don't know that it's coming. I know that the people are pushing for it. Advocates are pushing for it. You've seen an enormous response from advocates at the community level, at organizations, nonprofits that are saying you need to decarcerate these institutions. And whether or not at the government level those conditions have made it to where we're having serious conversations about emptying our prisons. But there's also a growing desire to change criminal justice policy from filling those prisons in the first place to legalizing a drug consumption, which is the war on drugs is one of the leading causes of incarcerating, especially racial minority populations. And that's also a conversation that has to be had where, in terms of disasters, we're trying to draw and show people these connections, that the same communities that we see that are most vulnerable to hazards exposure to the incoming impacts of climate change are socially vulnerable. So racial and ethnic minorities, low income communities, those with disproportionately high levels of physical or mental illness, addiction, and a lack of accessibility to housing. Those are the same populations that fill our prisons. And that's because incarceration looks and targets marginalized persons. And so when you have the same people that are in the community are filling our prisons, and so you see how incarceration could actually enhance the impacts that we see on those vulnerable populations in the community.
All right, Carlee, this has been fascinating discussion, and I think we could have more. We want to highlight this issue certainly on simpatico. We'd love to have you back. Maybe there's a paper that you're working on, and maybe there's a focus area. We'd love to continue this conversation. But I just think it's fantastic what you're doing. And I want to take you into just chatting before we close this out. But thanks for coming on simpatico.
Yeah, absolutely. I'm glad to, draw attention to this issue, and I'm working with a group of scholars we're trying to draw more attention to this issue. I'm also working with a organization, the Texas Prison Air Conditioning Advocates, and they are working to address extreme heat in Texas prisons. And that started with just having their loved ones being incarcerated and feeling the devastating health impacts of being incarcerated in Texas in the heat of the summer and not having access to air conditioning, to temperature regulation. And so we're working to bring more attention to that issue as well. There are some bills in the legislature here in Texas that are trying to draw attention to, we need to address this. We need to, address the prison conditions that are causing a lot of harm, not just to incarcerated persons, but also to the staff that work there.
Wow, well, that's very encouraging. Okay, well, maybe those are some things that we could focus on later on in maybe a future episode. But thank you again for coming on. And like I said, I want to take you into just chatting before we close out this episode, but we'll be right back.